Good afternoon, everyone. Harold and I wanted to provide you guys with some updates of what's going on in the company. Lots of news out there. Of course, out in the news, there's also a lot of noise. So we're going to talk about some good news for the company, some reasons for optimism, and for an opportunity for us to take some next steps. So the good news for the Continental team is one of our team members worked extra hard to develop a ability for all of us to be tested if we wanted to be for the coronavirus. So there's a CLA lab, that's the certified lab, has availability for the PCR test. The PCR test is the most accurate, as well as the antibody test. So the company's providing free COVID-19 testing for every employee and every household member of every employee. Now, why are we doing this? Well, there's three reasons. One, we think it's important for you to have knowledge of your personal health. This is something all of us have struggled with coronavirus, is having the data to be able to understand, what's going on and what's particularly what's going on with me. In addition to knowledge about your own personal health, help mitigate any asymptomatic spread. Real important with this type of virus. And the other thing is to help Continental safely return all back to work in the office. So as we look at the things that are out there, let me talk about a few things. We're all familiar with Brothers Keeper program. Now, this is a program that the folks in the field live by every day. And it's one I know everyone in the office is familiar with, but I'm going to talk a little bit about what Brothers Keeper means. That means that when I'm on my job, and this is particularly acute when you're out on a drilling rig or out in the production facilities, but when I'm on my job, I'm not only looking after myself, but I'm looking after my coworker. And so that's the Brothers Keeper. And so a good portion, a good essence of what we're going to be talking about today is all of us being our brother's keeper. And for those in the office, that really gets down to fully read, fully understand, and fully live by the safety protocols to keep not only yourself safe, but your coworkers safe. So as you return, please be reminded, all the posters, all the reminders out there, all the hygiene practices, social distancing. These are the things we've all heard about, we've all read about. We know those are important. If you're sick, if you have symptoms, if you've got notification from somebody at home that they've been sick, you should be going home. Prevention is absolutely the key on this, and it'll take all of us working together to make this work, collectively and individually. So the good news, CDC has consistently communicated that office environments like ours present a very, very low risk of transmission. In fact, the testing numbers that we've done on ourselves show that. We took early precautions while working in the office to keep all of us safe. Those precautions in the office are still in place. So when you come back, all those things that were there as protocols, they're still there. As I mentioned in my email last week, we tested about 137 people, and no one tested positive for coronavirus. So as we repopulate the office environment, the guidelines for the office we put in place, just to repeat, will continue at least until the end of May, and we'll evaluate it at that point in time. Now, as a reminder, government guidance, government protocols related to the peak were established to manage hospital capacity. I think we all understand that. We're an essential industry. That gets repeated to us just about every day. In fact, the governor just recently as today, has talked about the importance of essential industry. Why are we essential? Because we're essential. We literally are driving the economy. We power the economy. It's important for us to make sure that we're delivering everything we can, and the capability this company has is delivering at full capacity. What this really means is that the livelihoods of a lot of people in our community depend on us, depend on the industry, and depend on us performing at the highest level of performance. Now, it's important to support the effort by running our business as optimally as we can, and while doing so, practicing good social distancing. It's our duty. It's our duty to ensure we do our job to support the state and our country. And if we don't, another company or maybe the Saudis will. So remember, oil and gas is needed and will be needed even more while the economy is recovering. Now, I've had personal discussions. I wanted to share some of those with you. I've had personal discussions with CEOs of top hospitals. I talked to one of the top 20 hospitals, the CEO, president CEO of one of the top 20 hospitals in the country. Talked to top state of health officials, talked to elected officials, elected leaders. I've talked to physicians in the petroleum industry, and I have their assurance that our protocol is appropriate and it's safe and even goes beyond what the CDC recommends. Their governor has reminded us that we are an essential business. Now, essential businesses should be in full operation now. As such, we should safely be as close to full capability as we can. We've received the question, well, why do you want us in the office? Well, this is why. We perform at Continental Resources at the highest level of performance by being in our office and work environment. So this is something that is important for us to do. And this is a matter of keeping the economic viability of this company going as well as this industry. These are critical times. I don't have to tell you that. You know that from everything you've talked about with each other, what you've seen on the news. Oil was under $20 a barrel yesterday. It could go lower. We're seeing that refineries are shutting down. The capacity is dropping. So we're going to see possibly even further degradation in our businesses. And we are all working to ensure this company survives. Your individual efforts play a significant role in our survival. The economy of the U.S., you've seen the pronouncements as I have, it's at risk of being in a deep recession. And this is something that the whole economy of the U.S. needs to get back to work to ensure that that does not happen. So based on the evidence of our testing today, we've shown it's possible to do both. We can work in the office and be safe. This has been the consistent guidance of the CDC. We can go to work in an office environment, earn income, provide for our families, while at the same time take the very, very cautious steps required to prevent the spread of this serious disease. We're taking all the recommended steps that the CDC has suggested, and we're even going further than that. Those the recommendations that we're putting in place in our workplace. Even in a pandemic, we must take necessary steps to protect our health, do our jobs, pay our bills, preserve our families, strengths, and stability. We're all following government guidelines and returning to work. Now, I know that all Americans know we need to return to work to avoid an economic catastrophe. That's that potential for recession that we're talking about. The return to office plan, I'm going to go in and talk a little bit about details, what's involved in that. But here's what we're going to do. Here's the timing. We're going to take tests. So we've offered everyone that you can take a test. That's why we set up the lab to be able to do that. We're also offering for those that, for whatever reason, do not want to take the test. I've taken the test. I was one of the first ones that had a chance to do that. It's not that bad, and it's worth having the information. I encourage everybody to take the test if they can. You and your family members were appropriate. The other option to come back into the office is you can self-certify. You can self-certify for 14 days. No family, yourself. No one's had close personal exposure with someone that's at risk. So this is what the two criteria for being able to come back into the office are going to be in place. So the approach for that is for you to do those and then come back just as soon as you can. You're going to be working with your supervisor on being able to do that. And we're going to be trying to come back with about 50% capacity to start with. So there are still time slots available this week. I'd encourage you to try to get yourself in, get yourself tested as much as possible. For those that have already tested and you've tested negative, you're welcome to come back into the office. We will have a protocol of every day we're going to need to self-certify that in the last 24 hours, I have not been exposed. I haven't run a fever. So those are part of the protocols you'll see as we bring everyone back into the office. And again, starting next Monday, we're looking to ramp back up to 50% level. Again, work with your supervisor on whether that's you or one of your coworkers. But we're going to be going 50% next week, and then we're evaluating it, seeing how that works, seeing if that looks like all the protocols we have in place are appropriate, and then we'll continue to ramp up from there. I know there's a lot of issues with each of us, and each one is different. Every family is different. Every individual is different. I know there's a couple of things out there. One, I want to make an absolute important reminder. If you are at high risk, if you have a family member at high risk, those are considerations that you absolutely, I strongly encourage you, you absolutely should not be coming to the office. So I want to strongly encourage you to make that decision yourself, but this is a thing that we want to make sure that everybody stays healthy, and we all have seen the track record of those type of at-risk scenarios. The other is, I know child care is going to be an issue. There are child care facilities open. They are an essential business. And so as you get to coming back into the office, child care is an issue. Please work with your supervisor, work with your HR partner, and we'll figure out something that makes it work for you. So I'm going to go through a couple of things, but again, just to highlight, a lot of these I'm repeating for emphasis. We will be doing self-screening for coming back into the office. We encourage you to take your temperature every day. These are the steps that I think will help us ensure that we continue to stay safe here. So, repeating, we're closing. We're repopulating the office. We have an opportunity for you to get tested. We're going to be at a limit of about 50% coming back into the office for the first week, and that's starting as soon as we can get the people back here. And next week is the target to have that there. And we are going to continue to practice the social distancing. Importantly, you have to test, you have to self-certify. If you cannot do either of those, or your supervisor feels that your unique situation provides an additional risk, then that's something that is going to prevent you from coming back to the office. So before I turn it over to Harold, I want to talk a little bit about some of the things that he's been involved with. And Harold's been working tirelessly on not only the health of our employees, what we need to be doing in the company, the health of our company, but also the economic health of the industry, the state, and the nation. He's been testifying at the Railroad Commission. As you've seen him on TV, he's been working with the president, working with OPEC, and was able to affect about a 10 million barrel reduction across the world. This really needed to happen to put a little bit of floor under the oil prices that were out there. So he's also been nominated to be on the president's task force. Harold will talk to you a little bit about what's involved in that. That happened Tuesday of this week. And this is where a lot of the top business leaders in the country are working with the advisor, with the president, to help advise him on where to take the economy. So I really appreciate all your hard work, all the focus you're doing this time. yeah, I've really long admired the resilience of the Oklahomans, the resilience they show, and particularly during really tough times, times of hardship. Probably no better example than the Oklahoma City bombing, and I think everyone knows that we're remembering the 25th anniversary this weekend. So I know everyone will take an opportunity to take a moment, say a special prayer. Also, Blue Halsey, who is on the Oklahoma City National Memorial, will send out information to each of you, so knowing how you can help honor those and help honor Oklahoma. So let me close with saying brighter days are ahead. Continue your part. We need you back in the office in order to make sure this company is operating at full capacity. So with that, let me turn this over to Harold, and he'll share some thoughts with you as well.
Good afternoon, everybody. I know that this has been an arduous situation that's gone on the last 4 weeks, and tough times, and calls for some extraordinary situations and actions. And our company's looked at it every way we can. Make sure, number one, as Bill said, that everybody's safe, and we're doing the right stuff. And it appears that from the outcome of the testing and the overall situation with our employees, that that's happening. So we're really thrilled about that. But we have a job to do, as Bill said. We certainly are in an industry that is very vital to our nation, to our state, and certainly to our city and community. So we need to get back to work and do it in a manner that is safe and also very effective. And I know that some people say, "Gosh, I can just work as well at home," and mostly some people can very well do that, and we'll have to continue some of that as we go forward. But we find that our synergy in the office and within the company is certainly a very big part of who we are, what we do, and how we do it. So I wanted to talk just a little bit. We've gone through about 4 weeks of this, and it's certainly been different than any of us ever thought we'd ever live through, including me and most anybody I talked to. But anyway, we're at the point. I think all of us realized that we had to make sure that we didn't overrun, our health facilities. And the good part of it is we're in an area of the country we didn't do that. We haven't done that. In fact, a lot of the hospitals are empty, and we need to put doctors back to work, and also hospitals across the country, so across community. So electives are have been let go now. You can have your elective surgeries done, and that's a good thing. Heard about people with aneurysms that couldn't get them done, and certainly that was worrisome. So anyway, the president has selected me to be on a committee, a broad-based committee, actually across about 16 different categories of the overall economy in the United States, realizing that we have to get the country back to work. So we had our first meeting yesterday. had everybody on the call, some 120, 150 people, and had a lot of good comments that went back into that, how we could do that, turning loose geographical areas of the country. Those states that doesn't have but maybe 350 cases so far, and certainly the less densely populated states around the nation. We know we have to go back to work. As Bill said, we could have an economic catastrophe on our hands if we didn't do that. We have a president leadership that's been tremendous throughout this. The fact that Congress finally came together and came together with legislation that made some payments that is now being well received across the nation. This is going to have a lot of impetus. A lot of things talked about yesterday that could be very far-reaching as well in the next several months, and so that's good. I know that here in Oklahoma, our governor is also looking ahead, and will come up with recommendations for how we should proceed quickly in our state. And I think maybe the dates may be as near as May 31st, but it's going to be a different opening up across the nation, across Oklahoma, across the states that are opened up. We're going to have to continue watching what we do, social distancing, making sure have the best hygiene, all those things. And whether or not we're working here in the office or home, you have to continue those things as well. So anyway, appreciate how everybody has worked with us. The good thing is we're in a less densely populated state than most. We here in Oklahoma City, we don't always have the fanciest things going on in our city, but we're not stacked on top of each other. We have a very good cultural condition here in our state and city, and it's certainly paid off right now. So we also have a very stable company. We haven't been over the skis. We can weather this storm. We've weathered a lot of storms. We'll get through this, and we'll apply the very best thinking that we have the very best management. I know that each one of you will do your part, and we can get through this in good shape. So thank you for what you're doing. It'll be great when we're all back together and can meet, have our monthly, quarterly meetings and all those things. We'll look forward to that in the future. Also look forward to a vaccine that can end this pandemic once and for all. So thank you very much. Appreciate it.